Perfect. All right. Good morning, everybody. So we've officially started recording, so we'll just go ahead and get the meeting started since we're full pack, our agenda's full pack today, and just gonna get through this. So for all of those who I've not met yet, my name is Caitlin Long. I am the new Boards and Commissions Coordinator for BHA. I am helping Lindsay out from the administrative standpoint of BHA for our statutory required councils. So I help facilitate this one as well as 3 other ones. So for those of you who have not met yet, it's very nice to meet you all. All right. So just wanted to make sure that everybody can see my screen here this morning as we get going. Perfect. All right. Well, let's go ahead and start with roll call, if that's all right with everybody. All right. So do I have Ella Hawk here? Ella? If you're here, if you could just come off mute. All right. Deborah Monaghan? Deborah? Gina Robinson?
I am here.
Thank you, Gina. Chester DeAngelis? Chester? Sarah Pickle Sticker? Or Powell Sticker? Sorry.
It's okay. You're not the only one that's ever understood it.
Can you tell me how to pronounce your name?
Peel sticker, like you peel a sticker.
Okay. Sorry about that, Sarah. I am certified dyslexic, and yeah, just names in general for me, like numbers too. But sorry about that. Sarah Rushing.
Here.
Good morning. All right. Michelle Perry.
Here. Good
Good
morning.
morning, Michelle. And then Tamara Williams. All right. All right, everybody. All right. And just wanted to make sure that everybody had a chance to review the agenda today, that you received the agenda and then you had a chance to review it, and wanted to give you all some time if there's anything else that you would like to be added to the agenda today, if anybody would like to make a motion for that.
So moved. This is Gina.
Thank you, Gina. All right. All right. And then I'm dropping in the chat here right now. Let me see. Oh, I don't know if I can actually, let's see here. Okay, there we go. I have too many screens going right now, so. All right, I'm dropping in the chat the link to the previous meeting's agenda and meeting minutes, so we can go ahead and finalize those. So, oh, no, that's for today. Excuse me. This is the one. There we go. So this is the May 9th meeting minutes and agenda. If anybody would like to make a motion to adopt those.
So moved.
Thank you, Sarah. And do we have a second?
A second.
Thank you, Michelle. All right. Well, with that, let's keep moving on. All right. So, as you had a chance to review in this agenda, we have a couple of announcements for you all and wanted to talk over some things with you all today as well. So on July 2nd, I sent out an email with the first draft of the, I'm doing quotes with this, standardized bylaws for this new council, or for this council, excuse me. So going into the bylaws, the reason that I did the quotes is because when I first came to the state, this was my first introductory task, and they said, standardize the bylaws for all of our statutory required councils. So as we started developing this and talking with some of the other councils, we realized that the word standardization is not the correct term that we're trying to use here to explain what we're trying to do with this. So when I'm referring to like the standardization of bylaws, basically this first draft kind of encompasses all of the statutory language, all of our statutory requirements, and then just kind of breaks down a little bit further as to the roles and responsibilities of council members, council officers, which we'll talk about in just a little bit, as well as recruitment strategies and things of that nature. So now what we want to do is start working with you, the council as a whole, to really develop these further to make this unique to the needs of this council. So when again, so that's why we're saying they're saying standardization, it's just like the first draft, and now we're going to start getting more unique and really start fulfilling the needs of this council. So wanted to create a little space today to talk about this and make sure that you also received the link to the feedback form and basically how to complete the form. And then also wanted to see if you all were interested in setting up, some ad hoc meetings that you can attend as you would like to start, reviewing these in a little bit more detail outside of our regular scheduled council meeting. So as you can see here with the first draft of bylaws that you received, we want to include a mission and vision statement for this council that we would like you all to create. We really want to know in your terms, exactly why you exist. How do you view this council? How do you view your roles within this council? Same with the vision statement. What matters most to this council? For what problems are we trying to solve and for whom? So these are some things that we would like you all to start thinking about, and we can start working on language together. But this is, the first step in making this unique to this council. And we really want your all's voices and opinions to shine within these bylaws as well. So moving on to, Article 1, this is basically all-encompassing statutory language. As you can see here, this is our statutory site that we are listed under in state Colorado law. This is the duties as described by the law, and then the purpose is just kind of a more in-depth description of our duties. Then in Article 2, we have membership. This is going to be taken from statute directly. This is the required seats that we have to have in order to be compliant with our statute. So, coming down here, we have membership appointment. It also is taken from statute, and we just kind of go into a little bit more detail with all of this information. Same with new council member duties, officers, and things like that. So, wanted to make sure that you received this, and then wanted to ask if you had any current questions about the bylaws from the little bit of time that you've had to review.
Is there a timeline in which this needs to be completed?
Yeah, so on the bylaw feedback form that was also incorporated in that, we're asking for you to get at least your first round of recommendations in by September 1st. So this is on the email that was sent out on July 2nd. Please let me know if you do not have that email, and I will forward it to you immediately, because we would love to get your feedback for all of this. So on the feedback form, you'll see how it's kind of broken down into sections. So for Article 1, you'll go back to Article 1 as I scroll up. And then if you have, any comments, concerns, recommendations, please just be specific when Article 1, say, number 1 creation, and then give your feedback in that specific section. So our first round, we would like to get, your first round of feedback by September 1, so we can really start working to build these out and get them officially voted on, and we start working through these and abiding by these sooner rather than later. Goal is, to have them completely voted on and acted upon by, I would say January. But if we need a little bit more time and you all aren't feeling comfortable about voting on them yet, you'd like to, do a little bit more in-depth dive with them, we absolutely can do that too. That's just kind of, end goal, but we're flexible. And then I know that a lot of people receive a lot of forms from the state, so that can be daunting and frustrating. So I wanted to also create the opportunity to have, just like a standing meeting, maybe once or twice a month for you all to join in as you're able to, so we can start working through each individual section of the bylaws. So if you don't feel like completing the form or you just have too much, if you want to just come and speak with me, we can absolutely do that. If you all are interested. My apologies, the mailman's here. My dog goes crazy every time. So, how does that sound for the ad hoc meetings to review? Are you all interested in that? Would you rather do the form? Any sort of feedback for this?
I was gonna say, I just saw the comment in the chat. I'm open to either, but do you mind please sending me that feedback form again, please?
Absolutely.
Thank you.
With notes for myself. Does anybody else need me to re-forward the email from July 2nd? All right. What I will do is I'll just go ahead and create a time and then send out that Zoom information with a copy of the bylaws and the feedback form as well. And then for those who are able and would like to participate, we'll just hold, kind of these office hours for bylaws that we can start working through. And then, of course, I will be continuously checking the form and start incorporating your feedback from there. So next council meeting, we'll review, the comments and questions and everything that you all have asked within the form or the office hour meetings. And we can start working through these together to build them out in a little bit more detail if that works for everybody. All right. Any other questions about bylaws before we move on? All right. So I wanted to talk a little bit today about the council meeting schedule. So I know that this council only meets quarterly. I wanted to, meet with you all and talk today to see how that quarterly meeting is going, if you all feel as though this is enough time to meet, if you would like to start meeting more frequently, such as, every other month. Just wanted to kind of get your all's opinions to see, how the quarterly meeting schedule's been going, if you feel that this is adequate enough, if you feel that, you're impacting your communities and the behavioral health system in the way that you wanted to when you originally joined this council. Just wanted to kind of create some space today to talk about our meeting schedule to see if you would like to increase it at all, if you would like to keep it the same, and get a little bit of feedback from you today about that.
I'm okay with keeping it the same.
Thank you, Michelle.
Yeah, same here.
Yeah, me too. Quarterly has seemed to work fine.
Sounds good. Well, in the future, if you feel like this is not enough time to meet, if you would like to start, meeting more frequently, we can absolutely do that. We just want to make sure that we are giving you all the space to, advise in the way that you would like to, and just make sure that your voices are being heard in the manner that you would like them to be heard. So if at any point in the future you'd like to reevaluate and, start meeting more frequently, we're happy to do that. Wanted to kind of put that out there. All right. So next, we have the creation of an executive subcommittee and the application that consists of. So in the bylaws, you will see mention of an executive steering committee. This is going to be required for all of our statutory councils moving forward. We are going to be voting on a council chair and a vice chair for this council. We've done it in all the rest of the councils as well. And that's just going to help us with, communication, organization, and things like that. I know sometimes it can be really difficult to communicate with absolutely everybody at all points in times and lots of emails and things like that. So by creating these leadership positions, we'll be able to work directly with the chair and the vice chair in order to get, communication out and some more of the administrative things done in a more timely manner. And then they'll be able to communicate with you all directly as well. So you won't just be getting email after email after email from BHA, because I know that can be frustrating to see all of that. But with the executive subcommittee, this is going to be time for the chair, the vice chair, and other members of the council who would like to volunteer to come and help us create the agenda for the next meeting. We'll also talk about things such as membership and recruitment strategies. We'll talk about things such as bylaws and some more of the administrative things that the council will need moving forward. So wanted to kind of put that on your radar. Again, for the chair and vice chair, whoever are nominated and are willing to serve as that officer position, they will be required to attend the executive subcommittee meetings. Obviously, we know that life comes up and things happen. So if you miss one or two here and there, not a big deal, but that will be, pretty much just a standard requirement for those officer positions. And then anybody else who would like to join to be part of this. So the meetings won't be very long. They'll be about 30 minutes and we'll meet a couple weeks before the next upcoming meeting, again, to mostly create the agenda, but then do any other administrative tasks that might need to be completed at that time. So as you can see here, here's the link to the application. So if this is something that you are interested in, please go ahead and volunteer for. We will schedule time around your time. So please just select out of these what you would be available for. And then we can get something scheduled in the future. And if we need to readjust time and meeting dates, we absolutely can. This is just to kind of get an idea of when the majority of people would be able to meet. We are looking for around 4 to 5 members. So that would include the 2 officers. So we're looking for an additional 2 to 3 volunteers if possible. Just really want to get, a more diverse than, just the officers' perspective when creating agendas. And we really want to hear from you all and your communities and what's going on in your neck of the woods to be able to incorporate that into council discussions as a whole. So any questions about the executive subcommittee? Any concerns around the executive subcommittee?
Just wanted to make sure you saw Ella's comment in the chat, so I think that's a relevant point.
Thank you. Your second is first one, but the structural organization of the board, detailing the role. Absolutely. So, Ella, that is something that we can discuss with our bylaws, and we can establish, that council liaison position and what the roles and responsibilities of those council liaisons will look like. For other councils, we do have, cross-council liaisons. So, for example, a member of our behavioral health advisory board council will come to the mental health advisory board council meeting to see if there's like any overlaps there that they can bring back to their board, or we can work with the other board to achieve. But specifically for these youth representatives, I would love to speak to you more about that, Ella, and Lindsay as well, just to get a little bit more information about that and kind of what the previous discussed roles and responsibilities were for that, make sure that those haven't changed, and then we can start incorporating these liaison positions within to our bylaws. Does that answer your question about that? Okay, great. Thanks for pointing out the comment, Sarah. Right. Anything else about, bylaws or the executive subcommittee before we move on? I know this is a lot of information early on a Thursday morning, so if you need, please don't hesitate to reach out if you have any comments, questions, concerns that you haven't brought up right now. My virtual door is always open and my door is always open, so I'm happy to meet with you outside of these council meetings. My email has my cell phone number too. Feel free to text me or anything like that. I'll also be sending out recordings of this meeting so you can review at a later date and time. And if any other questions or anything pop up, please don't hesitate to reach out. All right. Let's see here. And then last on my agenda, for me anyways, is the council officer nomination. So as we have previously discussed, we are looking to establish a council chair and vice chair. Again, these are going to be kind of leadership roles within the council that will help support the council as a whole, as well as BHA. So the role information is taken directly from the bylaws. So if you review the bylaws in a little bit more detail, you'll kind of see, some of the additional roles and responsibilities around council chairs and vice chairs. So instead of, Lindsay or myself leading this meeting and talking a lot, we want, the council chair to be able to take that leadership role and help facilitate the council, navigate the conversations for the council meetings, and prepare for upcoming future council meetings, as well as possibly creating subcommittees or whatever may need to be done for the needs of this council. The vice chair will basically be that chair's support role. So if for some reason the chair wouldn't be able to attend a meeting one day, the vice chair would take over the roles and responsibilities. The vice chair will also, just be the overall support. So if the chair asks to designate a task out, the vice chair can facilitate that, or, however that working relationship will be between the chair and the vice chair. So we'd like to get this in by September 27th. This is not a very long form at all. You are able to vote for yourself. You're able to vote for as many people as you would like to be chair or vice chair. And then once we get your nominations in, I will reach out to the highest voted members to gauge their interest in serving as chair or vice chair. For this council, it's not going to be a crazy heavy lift at all. It will require, some additional time and some additional responsibilities, but, it's not going to be a second job. Don't quit your day job. It's not going to be anything too daunting, but we're also going to be here to support you every step of the way. I've been working on training specific to these positions, and really just want to be able to support you in any way that you might need from us. So don't feel like if you want to take on this leadership position and you're nominated, that you're just in this alone, because that is not the case. We're going to be here to support you in every step of the way. But we would just like to get a little bit more engagement from the council members, and really encourage you all to lead your council as you would like it to be led. So again, if you all, this link is in the agenda that you all have, but if you could submit your nominations by the end of the day on Friday the 27th, that way we can reach out and start gauging interest in serving as these officer positions. And then by the next council meeting, we will take a formal vote to formally enact them into these leadership positions and then start moving forward from there. Does anybody have any comments, questions, concerns about this? Seeing some nodding. All right, everybody. Well, we are just cooking through the agenda today. So next, oh, I forgot my one last thing down here is the proposal. So in working with some of our other statutory required councils, some of them have statutory compliances that they have to meet and some don't. But basically what I wanted to propose here is to see, if you all are interested in creating an annual letter of recommendation that we can present to the BHA as a whole for them to incorporate in their annual report to legislation, and then, kind of start building out these conversations a little bit more. I know that a lot of the other councils, I've only met with you all once before, but in speaking with a lot of the other councils, they feel as though they're having great conversations, but that's about it. They're not really seeing, what's happening with the conversations and the recommendations that they're making. And so by doing a formal letter of recommendation that we can submit to the BHA, each year we can kind of go back and look at the recommendations that we've made, and we can build off of that to see, we recommended this. This is how the BHA implemented it. Was that sufficient enough? Do we need to make additional recommendations about the specific topic? So just kind of wanted to throw that out there to see if this is something that you all are interested in. Again, this is an advisory council, so we want you all to advise in the way that you all see fit. And, if you are feeling, again, like you're having amazing conversations, but what is actually being done around these conversations, we want to give you all this opportunity to, put this in black and white so the BHA can submit it in their annual report and we can continuously follow up on this. So what are your all's thoughts about this?
I think that sounds like a great idea.
Thank you, Anastasia.
I agree. I feel like we have great conversations and then it doesn't really go anywhere. So yeah, I agree.
Yeah, thank you, Michelle. Anybody else?
Caitlin, this is Ellen Stern with Children's Hospital. I think that's a great idea. And I'd love to think more about how not just legislative work links up with the recommendations and conversation here, but also the BHA's implementation plan for children, youth, and families. Or I'm not sure if I'm using that name right, but just other ways that the BHA is doing work in this space would be really helpful to think about ways that we can lift up and support or provide guidance through those mechanisms too, not just legislative, but also operational and programmatic work that the BHA is leading.
Yes, definitely. And yeah, that's exactly it. If there's a program that the BHA is lacking right now that you all are like, this needs to happen, this is the way that we can, put it in that black and white and submit it to BHA and give our reasoning as to why. And then, from there, start working to, build out programs and get that additional support that is needed, not only for you all, but your communities and Coloradans as a whole. So, great. Andrea?
I am hoping my audio is working. Is
You're
it?
good.
Yes. Okay, it's been a struggle. I wanted to kind of echo that point, which is that somewhat selfishly, it's always helpful to have something in writing that we know is agreed upon, the direction of the council, the recommendations that they can make, because outside of even legislative session and the legislative report, annual reporting that we have to do statutorily, we do rulemaking, we do all sorts of other programmatic activities and contracting throughout the year. And it's really helpful to have that broad scale overview of here's where all the programs touch, and these recommendations carry over here, maybe not here. And doing that analysis is really helpful to have like a foundational document for us to use. And we've found success with that in other councils. So again, like Caitlin said, it's up to the council how you want to present this information, but echoing that it can be used across multiple areas of BHA and isn't confined just to legislative session. So.
And, this will also help us prepare and build out the agenda for future meetings as well. So, for example, in one of the other councils, they are currently submitting their letter of recommendation. And, in one of their requests, they're asking for more engagement from leadership from some of the divisions within BHA. So we can start using those requests to, in the February meeting, we'll have this division come and speak to the council about what they're doing right now, the programs that they're offering, if there's any questions that you might have about that, any comments, concerns, and then they can incorporate that. They can follow up with this later. So it just kind of helps, not only for recommendations for BHA and the state as a whole, but also for us to kind of plan narratives around what we're looking for in these council meetings and really start opening it up to more engagement from leadership and other divisions to, be able to even present you with resources that you might not know that we currently have. Ellen.
Thanks for that conversation. I just wanted to ask in relation to the council, the executive committee that you all are standing up, would it be a role that those folks would draft this piece for the BHA's consideration, or is it a staff-driven recommendation?
No, so it wouldn't be BHA, it would be the council's recommendation for sure. We absolutely could use the executive subcommittee to help create this, or we can create a new subcommittee, which is what a lot of the other councils have done, and call it, the report writing subcommittee. And then we can meet at, dates and times that work for any volunteers who would like to participate in this, and, really start working together to build out a template, and we can bring our drafts back to the council as a whole to see what their recommendations might be to include in our letter of recommendation. If they have any comments, concerns, questions about what we've brought up within the report subcommittee, we can absolutely bring that back and, just continue to facilitate it as a council as a whole too.
Yeah, that's great. I just was thinking of concrete ways to make sure that people who get that leadership role are able to help support the council and think about some of those systemic issues, which I'm a broken record on, around like insurance access for this council in particular, to be thinking about ways we can link up to not just the implementation plan, like I mentioned before, but also gaps that we maybe have found in the data, and how we can think about other policy opportunities and system reforms. So I appreciate that.
Absolutely. Yeah, that's exactly why, we proposed this, because, you all, like I said, are having amazing conversations. You've identified some of the gaps that we have in data. You've identified some of the gaps that we have with regard to programming and things like that. But now it's time to get those recommendations and those gap identifications over to the BHA in black and white and be like, this is what, we're advising on. This is what our communities need. This is what we need. Let's start working together to, build these out. And so I think that this is a great first step in that process. And like Andrea was saying, it's something that helps the BHA to be able to kind of go back and reference when, you know, starting to create these and seeing what your recommendations are, and how we can start incorporating that into larger systems as a whole. All right. Well, yay, I'm so excited for this. In the email that I will be forwarding for the Zoom information for the bylaws, I will go ahead and create an application for the annual letter of recommendation, and see if we have any volunteers that would like to participate in creating a report subcommittee, or if we should just, you know, stick with the executive subcommittee and use that time as well. We absolutely can. Just wanted to kind of get a little bit of feedback from you all based on your availability and your desire to volunteer and participate in these. So there'll be follow-up emails with lots of information, so just keep an eye out on that. All right. Not seeing anything else in the chat. Ellen, did you have another question?
Oh, sorry, no.
Okay, just want to make sure. No worries. I do it all the time. So. All right. Any other comments, questions, concerns for the good of the group from everything that I've discussed this morning? I know it's been a lot of information just kind of thrown at you. So again, please feel free to take the time to digest, review the information. If you have any comments, questions, concerns, please do not hesitate to reach out to myself, Lindsay, Andrea, whoever you might need. We're here for you. All right. Well, with that, we're a little bit ahead of schedule, but I will go ahead and pass it over to Andrea to give us some updates on rules.
Hi, everyone. Okay, for anyone who hasn't met me or interacted with me before, I'm Andrea Jones. I'm our Deputy Policy Director over at BHA. Mostly I've come to this board and talked about rules, which I'm about to do again. And then I'm going to beg your forgiveness because in some ways this is going to sound like a broken record to this board, which is we're still working out all the procedural mechanics for how we're going to promulgate the rules, which is just fancy lawyer speak for who are we going to, like, which authorities are going to do these rules. It doesn't change the fact that the substance of those rules needs to exist. And some of those things are adjacent to this board, the recommendations that you make, concerning entities that we license directly, the program itself. You can make recommendations around any of those. We do have that rule set that I believe is, when was the last time that recommendation letter was reviewed or to the rules, Lindsay? It was like 22, right?
I think so.
Yeah, I believe that's right. That was the date on it.
Okay, so systems, legislation, statutes have changed, possibly not significantly in this realm, but I think a review of those rule recommendations is in order. And also, you can expect stakeholdering of whatever those rules are, those systems rules, like not the provider rules for who we regulate directly, but those systems rules to be talked about, messaged. We will make sure that this board is aware that these stakeholdering sessions are happening late September to early October. Currently, our community engagement team is setting those meetings and dates, and we're building the communications around that. Therefore, this board will have plenty of opportunity to engage there where it's necessary, helpful. I would say in the interim and kind of what's left of August, I can't believe we're here already, and most of September, sort of review the rules in current state, although I know that might not be that current right now, so that we're prepared to start engaging in those conversations and stakeholdering and rulemaking in 6 weeks-ish, 6 to 8 weeks. Oh, Also, I will put my email is in the chat directly for any like regulatory rulemaking, more technical authorities of the board questions. That's where the policy unit as a whole can be really helpful to this board. So I will make sure and keep you all apprised of when these stakeholdering sessions are actually occurring, get all the communications out to you through Caitlin and Lindsay. And yeah, that's about it. We're pretty excited about it though. It's finally happening. So any questions? Perfect. Okay, I think I'm supposed to kick it over to Lindsay, right? You're up.
Thanks, Andrea.
Thanks. Hi, everybody. Let's see, I've got to stop sharing your screen, Caitlin, so that I can show mine. So at the end of our last meeting, I believe, I'm not remembering who, someone requested that we could revisit the data that we have on private insurance and CYMHTA's role in addressing a gap in existing coverage. And so I thought I would bring this data back around so that we could discuss it more completely. This data comes from our administrative services organizations, our ASOs. They share this information with us at the end of each year. And I went in and did an analysis of what the various services were that CYMHTA has been covering because private insurance doesn't. So many of the youth who come into CYMHTA do have some form of private insurance. As you all know, they can't be Medicaid eligible, but they can have private insurance. And in circumstances where private insurance doesn't cover or otherwise is unaffordable, CYMHTA will fund those services. So we had 83.5% of the youth with private insurance that needed CYMHTA because a service that was deemed clinically necessary was not covered through their private insurance. And so that's a lot of the CYMHTA youth who were coming because their private insurance wasn't sufficient. Also, we had 9.8% of children and youth with private insurance that were coming because they couldn't afford the deductible or the copay. So it's not just that specific services weren't covered, but it's also that even if it was it was unaffordable for the family. Specifically of the services that were not covered, I think I mentioned this last time, this finding broke my heart because I'm trained as a licensed marriage and family therapist, but 40% of the services that were needed that weren't covered was in-home family therapy, which was pretty striking. And I just completed an analysis of the services that were provided in fiscal year 24, and about the same rate of services that's what we provided in entirety. So not just anchored to the question of whether it's funded through private insurance, but in general was about in-home family therapy was about 40%. So it still is one of the largest services that CYMHTA funds. Yeah, Sarah.
I'm curious, the 83.5 and 9.8% don't add up to 100. I was curious if some of the folks that we're serving are people who are maybe undocumented and ineligible for Medicaid and insurance, or if we know what the rest of the 6.7% of people we serve, of people that received services but don't fit these other two categories.
So these were folks who had private insurance. That was the factor that was at play for this percentage. So these were all youth who had private insurance and were needing to access CYMHTA. And of those, this was the 83.5% were were the amount that said they needed to use CYMHTA because a service wasn't covered. So this isn't a breakdown of who had private insurance and who didn't among the population of our youth. So these were, I don't know the breakdown of if there were any youth who were undocumented. This was just of the youth who had private insurance. This is how many of them said they needed CYMHTA because they couldn't access particular service. Does that make sense?
It does. Is there any explanation of what the other 6.7% that aren't included in these percentages needed it for? Or
they needed it for, it was for something else. It wasn't just because it wasn't covered through their private insurance.
Okay.
Yeah.
Thank you.
Yeah.
What would be an example of that, Lindsay?
Good question. I have to go back and look at the data. I did this analysis a little while ago. That's a good question. I don't know what an example of that would be, but I can find out if you're interested.
I think it'd be good for us to track that. I keep bringing this up, but it's I think it would give us, even though it's a minority of the overall rationale for the needs with the program, it might be a good insight into some of the gaps that insurance might be providing or whatever else the rationale is for needing CYMHTA.
Mm-hmm. Yeah. Yep. I can go look at that. I will say too, CYMHTA does cover a lot of different services. And of those services, it covers a lot of different services. So this is not a comprehensive list. These are just the services that were listed as services that had been needed and weren't covered by insurance. Yeah, Brett.
And with the percentage that's missing from this, is that possibly the clients who didn't end up needing CYMHTA funding because the private insurance did cover the necessary services? Or is this 100% is only looking at the pool of people who were eligible for CYMHTA funding ultimately?
Yeah, I'm going to have to go back and look. I'm going to have to go back and look at that analysis to figure it out. I'll have to go back and look. I don't know if that's my memory is that I looked at here's what all of the youth who were listed as all of the reasons that were listed why someone needed CYMHTA and had private insurance. That was the data that I used to do this analysis. And so
so it sounds like it probably doesn't include youth who received a CYMHTA assessment, had treatment recommendations, and then through the care coordination process were able to access those recommendations through their insurance or decided maybe to pursue something different outside of those recommendations. If it was only looking at the reason for eligibility for CYMHTA funding, it's probably not looking at that pool of kids. Because I was just curious how many, it seemed like if only, I don't know what percent is missing from this 6%, if only 6% didn't end up needing CYMHTA funding or being eligible for CYMHTA funding, that feels a little bit low to me. I feel like just anecdotally, there's probably more clients who were able to kind of help through the care coordination process access services. So that's why it had just come up as a question in my head.
Yep. Yeah, I'll have to go back in and look at my analysis. Went to see if I could find my file, and I can't while I'm unable to focus enough to find it. But I'll find it and I can follow up for sure. Any other questions or comments about services not covered through insurance? I think this is interesting data. I haven't seen this data, this type of data before I started in this program manager role. I think it's very interesting.
I had another question. So if I'm trying to think back to, I think this data was just captured for, was it just the last fiscal year? There was a point in time when the tracking spreadsheet that ASOs who facilitate the program complete each year, when additional data fields were added to capture these pieces of like, well, what was the treatment service that wasn't covered by the private insurance? And I think some of that had grown out of desire to be able to work within the state, within different agencies, within realms of private insurance, to try and see if there could be some shift in how we are funding and providing for services for youth in the state that wouldn't necessarily long-term require a gap funding program such as CYMHTA, right? If families are able to access necessary treatment services through insurance plans, whether that's Medicaid or commercial insurance, I mean, that's kind of our goal, right? Is that we don't have to kind of shift people around into all these additional programs that have additional steps to go through to be able to access the needed care, that we'd like to kind of streamline that. And so I'm just wondering if there are ideas or plans for how, with this data being captured, what spaces it may be able to be taken into to have some of those conversations with Division of Insurance or with other folks in advocacy spaces, to be able to have some conversation towards overall system growth and change to make access easier to services that we are identifying are the problem areas where folks aren't having access.
Yeah, I absolutely, I'm 100% on board with you on that, Brett. And I was thinking too, with the letter of recommendation, that might actually be a good lever that we can pull as a group to make recommendations. Here's the data. We'll serve it up on a nice silver platter. Here's the data, and we would like you to take this and do something with it. And it might be me as the program manager. It might be related to the legislature, and maybe it's about requiring collaboration, or giving our commissioner information that she can take and do something with, as well as she's collaborating with her counterparts in other agencies. So I love that idea. And I do think there's a possibility that I do like this idea of the letter of recommendation, because I think it's an important lever that we can pull, and we'll have data for it.
Yeah,
I want to
I think that's a great idea. From what I understood about talking about the letter of recommendation, I see how that would be a good platform.
I think that's a great idea. I worry a little bit about the timing. So if we wanted to like run legislation or think about ways to work with insurance, you know, what is the timing of that letter of recommendation? It seems like we have some findings here that merit more immediate discussion with insurance. And I'd love to maybe look at the intersectionality of this data with, is it state regulated health plans that are, that we're finding to be the concerning area of like in-home family therapy, for example, or is it federal ERISA plans where maybe we don't have as much leverage? And I don't know if you have access to that level of data, Lindsay, but like the DOI can't do some things because of who manages and oversees certain plans. But maybe there could be a spin-off of this council to think about what those policy options are, or conversations with insurers are. And it would be part of the BHA. It could be the advocacy groups and folks who represent patients and families that have gone through this program.
Yeah, we do have, so in our data, we did collect who the insurance carrier was. So we do have the information about who the insurance carriers are. So we do have that. I haven't analyzed it, but I can do that for sure. That would at least let us know who it is, what levers are available for us to pull and which ones we can't.
Yeah, so maybe that's a recommendation, Lindsay, is you could come back to us with the 6% that we had question about, and then just the state regulated versus federal regulated plans and where there might be opportunity. And we could have a spin-off group think about the policy options, since this group only meets quarterly. It might be having the conversations this fall and thinking about if something could be legislated or discussed with DOI, as Brett suggested.
Yeah, I like it. Take a note for myself to do that. Awesome. Got it. And we have 1 year's worth of data from fiscal year 2023, but we'll have a second year's worth of data as of September, because I'll be getting the deliverables from all of the ASOs for fiscal year 24 at around that point. So I might actually even have 2 years worth of data that I can analyze for that conversation.
Thank you, Lindsay. That'd be wonderful.
Yeah. Great. All right. Any final thoughts on this topic? I don't want to move us too fast if others have thoughts they've been ruminating on and would like to share.
I have one question or point of clarification. Are these percentages with services needed also the services that are provided, or is that different?
So these are services that we provided because they were needed. So these actually occurred. These are services that were funded through CYMHTA because they occurred. Yeah. I am looking here to see, I did find my file. It looks to me like the folks who are not included in this analysis, it looks as though it's listed as NA in my data. So I have to go back in and better understand what that NA means. If it ended up that they were covered. So yeah, I'll dig back into this data. I'll dig back into this data and see what I can find. Which I'm very excited about because I love analyzing data. This couldn't be a better next step for me. Go back in and do some data analysis. Let me then, if there's anything more to be said about this or questions. All right. Then what I'll do is give you an update on the census. We currently, for fiscal year 25, so this is as of July 1st, the number of youth that we have provided services for, provided community-based services for specifically, is 149. So we've had 149 youth who've had community-based services funded through CYMHTA, and we've had 10 youth who have received residential services funded through CYMHTA. So far this year, we've discharged 12 youth. we have currently about 51 youth who've received assessments that are in the middle of getting linked up with either being determined eligible for the program or not, and then getting linked up with their respective services. And so total, we've served 171 youth in community and residential for the year. Currently, our median length of stay is 4.88 months. But we do, that's the median. When I calculated the mean, it was substantially higher. So it was 10 months. So I thinking through those two figures, I'm thinking the median is probably a more accurate representation of the length of stay. But so far, we've got youth with a median about 4.88 months in the program. Any questions about those?
See, it's Gina. I do have a question about that.
Yeah.
So we know a lot of these kids roll to Medicaid, right? So is your median including when they go to Medicaid and go off the program and may stay in, or is it just when CYMHTA is paying? Because I think that's a very different view.
It's just when CYMHTA is paying. So this is the median length of services that we've funded. And this is calculated, this average length of stay is calculated only from the youth who have been discharged so far. So we look at, for the youth who've been discharged, what was the date that they were admitted? And then what was the date that the clinical care coordination ended? And then, so this is the average length of that.
And that time is just CYMHTA funded.
Correct.
Would include Medicaid funded if they rolled over to Gina's question.
Yeah, correct. Yep. Because if they roll over to Medicaid, we would have discharged them, which is why we use the discharge date.
Thanks for explaining.
Yeah, sure. Absolutely. Any other questions about our census? This is as of this morning. All right. That's all I got for you. So I'll turn it back over to Caitlin for public comment.
Thank you, Lindsay. All right, we are definitely a little ahead of schedule here, so we have extra time. If any member of the public would like to come off mute, bring up any comments, questions, concerns. All right. All right, everybody. So going back to the agenda, it looks like we have listed for board planning agenda items for November and then closing. So for the November meeting, we will go ahead and have at least one of the executive subcommittee meetings possibly. Now that I'm thinking about it, the officers probably won't be formally nominated yet. So probably go ahead and wait until after November and then get that up and rolling by the first of the year. So for any agenda items for November, I know that we're going to follow up with Lindsay about a couple of things from today's conversation. We'll probably do a bylaw follow-up to see about any questions that you have presented via the form or the office hours that I'll be holding. Are there any other items that you would like to bring up for the November's meeting, you know, specific to your communities, your individual needs, incorporated into the council as a whole? Is there anything going on that you would like to speak about? Sarah, I will send an email out with all the information about the follow-up task. So just keep an eye out for your email from this. But basically, the big follow-up ones will be the bylaw and the bylaw feedback form, the officer nomination form, and the executive subcommittee application. So those will be the big three. They are currently linked in the agenda, but I will also send out individual links and just a recap of today's meeting email with everything included in there. And then we'll also do a proposal for the creation of a report writing subcommittee to see if we have enough volunteers for that. And then if we do not, we can go ahead and just work with the executive subcommittee. We might increase our meeting times to possibly an hour each executive subcommittee meeting. Therefore, we will have the time, to spend on the agenda and preparing for upcoming meetings, as well as doing report writing. So just depending on how you all vote and your availability and your willingness to participate, we can kind of ebb and flow from there. So anything else for next meeting's agenda? Any comments, questions, concerns about today's meeting? All right, everybody. Well, with that, we can go ahead and close out a little bit early. If anybody would like to make a motion and second the motion.
Gina, so moved.
Thank you, Gina. Anybody second?
Deborah, I can second.
Thank you, Deborah. All right, everybody. Well, the next meeting is set for Thursday, November 7th at 8:30 to 10. Ellen?
So sorry, I couldn't get off mute fast enough. I have been a temporary member on this council while we found a children's representative.
Yeah.
And were we voting on that today? Lindsay, I think you got her application materials over the summer for Lindsay Gaffey.
Yes, we did. I will need to send that out for everyone to look at. I haven't been able to do that yet, so we will have to move that to the next one.
Okay.
Yeah.
Can she join the next one? I just I'm happy to continue to play stopgap, but
yes.
I know eager to get on as well. She's got better experience in this space than me.
Yes. Yep.
Thank you. Sorry to interrupt. I know we were
perfect. Thank you, Ellen.
Thank you.
So yes, so keep an eye out for an email from Lindsay or myself regarding that application information, and then I'll add the formal vote to the agenda for the November meeting as well. And then during the November meeting, we can also talk about, recruitment strategies and things like that are outlined in the bylaws right now. So if you can, pay a little attention to that, and then any comments, questions, concerns that you might have over that, I'll be happy to share, the recruitment plan on, what we've proposed, and if there's any accommodations that we need to make to meet the needs of this council, we absolutely can. But it's just a proposal that we're kind of working through with some of the other councils as well, just to make it a little bit more formalized and make sure that, the statutory seats are filled and, members are understanding of their roles and responsibilities and things of that nature. So we can dive a little bit more deep into recruitment preparations and plannings and things like that. So next year, when we start doing all of that, we'll be good to go and set with everything there. All right, anybody? Anything else for the good of the group? Right. Well, thank you all so much for coming and participating today. We really appreciate you taking the time out to serve on this council. And just thank you for all of your help and your advice and your expertise on these matters. And then, as always, my door is always open. Lindsay, I'm sure, is the same way. So please don't hesitate to reach out if you need anything between now and November. And just keep an eye out on your email because we'll be sending a couple things along your way.
Thank you. Have a good day.
Thank you, everyone.
Bye, everyone.